Hi everyone, welcome back to my YouTube channel. Today we are going to talk about bones of skull. So let's start the topic with introduction, and here at the side you can see the diagrammatic representation of skull representing different bones. So you need to take that in mind for further understanding of the lecture. So, starting with the introduction, the skull is more than just a protective casing for the brain. It plays a pivotal role in shaping our identity, providing attachment site for muscle of the face and jaws, and supporting vital sensory functions. Its complex architecture, marked by numerous sutures and articulations, not only allows for growth during development but also serves as a guide in clinical and forensic examinations. Now let's talk about skull bone classification. There are 22 bones of skull that are conventionally grouped into two major categories, and these are neurocranium or cranial bones. These are the bones that form the protective case around the brain, and viscerocranium or facial bone, and these are the bones that construct the framework of face, supporting facial structures and sensory organs. Understanding this classification is essential for appreciating the unique roles each bone plays in both function and development. Now let's talk about neurocranium. Neurocranium is consists of 8 bones which encase and safeguard the brain. Each of these bones have distinct features and function, and these bones include frontal bone as you can see here in the diagram, parietal bone, temporal bone, occipital bone, sphenoid bone, and ethmoid bone. And these bones are you can see in diagram here at the side. Now talk about them one by one. Frontal bone is forms the forehead and superior portion of the orbital cavities. Its function is to protect frontal lobes of the brain and play a vital role in defining the shape of upper face. Talking about clinical note, frontal bone fracture common in traumatic injuries, and it can affect not only the brain but also the orbits. Second bone is parietal bone. That is also the bone of neurocranium, and it is two large pair bones that form much of the superior lateral sides of skull. They provide significant protection to the brain and form parts of cranial vault. The suture line where the parietal bone joins with other cranial bones are crucial landmarks in neurosurgery. Now talking about temporal bone, that is part of neurocranium. It is pair bone located at the sides and base of skull. Each temporal bone houses the structure of ear. They also form part of the mandibular and zygomatic arches. Fractures in temporal bone can result in hearing impairment or balance disorders due to their proximity to the inner ear. Next bone is occipital bone. Here you see in diagram the dark green color bone at the back of skull is occipital bone. This single bone forms the posterior and inferior portion of skull. It is the bony seat for the foramen magnum through which the spinal cord connects to the brain. Occipital bone is crucial in understanding the hand injuries trauma. Here may have significant implications for brainstem function. Next bone of neurocranium is sphenoid bone. Here you can see in the diagram the pink color bone near the orbit or at the lateral view is the sphenoid bone. It is the complex bone at the base of skull contributing to both neurocranium and the orbits. It acts as a keystone articulating with many neighboring bones. Its intricate structures support the pituitary gland and forms part of orbital boundaries. Abnormal growth or fracture in the sphenoid bone can have widespread effect due to its central location. Next bone we have is ethmoid bone. That is the delicate spongy bone that forms part of anterior cranial base, the medial wall of orbit and the roof of nasal cavity. It plays a key role in forming the nasal septum and small olfactory structures. Because of its fragile nature, the ethmoid bone is often involved in skull base fracture and can be a pathway for spread of infection from nasal cavity to the brain. Now let's talk about viscerocranium, that is also called as facial skeleton. Viscerocranium accounts for 14 bones that has shape and size that form the shape and size of the face. These bones are essential for aesthetics, mastication, and formation of sensory organ cavities. These bones include nasal bone, maxilla, zygomatic bone, palatine bone, lacrimal bone, inferior nasal conchae, and vomer and mandible. Two of these bones are unpaired while all of the other bones of them is the pair bones. Then talking about nasal bone, as you can see here in the diagram, the green color bone and anterior side of skull is the nasal bone. And these are the small pair bones that form the bridge of the nose. They provide structure to the upper part of the nose and contribute to the overall contour of the face. Injuries in the nasal bones are among the most common facial fractures and can alter appearance significantly. Next bone in viscerocranium is maxilla, that is the paired maxilla bone form the upper jaw and hold the upper teeth. They are integral in forming the orbit, nasal cavity, and hard palate, playing a central role in chewing and speech. Maxillary fracture can compromise the stability of mid-face and affect both dental occlusion and respiratory pathways. Next bone in the viscerocranium is zygomatic bone. It is also known as cheekbone, and these pair bones are located on the lateral aspect of face. They not only provide the contour of cheek but also serve as an attachment point for muscles involved in facial expression. Zygomatic fractures can lead to cosmetic deformities and affect orbital integrity, sometimes compromising vision. Next bone of viscerocranium is palatine bone, that is small pair L-shaped bone that contribute to the formation of hard palate and floor of nasal cavity. They are critical in forming the roof of the mouth and supporting structure within the nasal and oral cavities. Damage to palatine bone may affect bite and speech, necessitating careful reconstruction in trauma cases. Next bone of viscerocranium is lacrimal bone. That is the smallest bone of face located in the medial wall of orbit. They house part of lacrimal apparatus essential for tear production and drainage. Although small lacrimal bone injuries can lead to complications in tear drainage affecting ocular health. Next bone of viscerocranium is inferior nasal conchae. There are the paired curved bone within the nasal cavity. They help to create turbulence and inspire air, increasing the contact of the air with the mucosal surfaces for optimal warming and humidification. Structural abnormalities in the conchae can contribute to the chronic nasal congestion or respiratory issues. Next bone is vomer, that is a single thin bone forming the lower part of nasal septum. It divides the nasal cavity into two chambers, playing a vital role in airflow regulation and olfactory function. Deviation of the vomer or other septal components are common and may necessitate corrective surgery for improved nasal function. Next bone is mandible, that is the only movable bone of the skull that forms the lower jaw. It is critical for mastication speed and facial aesthetics. Mandibular fractures are frequent in facial trauma and require careful management to prevent occlusion and function. Now let's talk about development and growth of the skull. Formation of skull bone is a dynamic process that begins in prenatal life and continues in early adulthood. Ossification occurs in both ways, like intramembranous and endochondral formation. The suture, that are the fibrous joint connecting the cranial bone, allow for growth of skull in response to overall development of the brain. Premature suture fusion, known as craniosynostosis, can lead to abnormal skull shape and increased intracranial pressure, necessitating early intervention in pediatric population. Now let's talk about significance of skull. Understanding the bone of skull extends beyond basic anatomy. In clinical settings, the detailed knowledge of skull anatomy is essential for interpreting imaging studies, planning surgical intervention, and managing trauma. Features, congenital malformation, and degenerative condition all underscore the practical importance of these bones. Furthermore, evolutionary biologists study skull morphology to trace the developmental and adaptive changes that have shaped human history, linking from the function throughout the evolutionary time. Now let's talk about conclusion of this lecture video. Anatomy of skull is rich tapestry that interlocking the brain, each with distinct roles that contribute to the protection of vital sensory organ and thus facilitation of functions such as chewing and speech and the static attribution of the human face. Through an understanding of the cranial and facial bone, from the robust structure of neurocranium to the delicacy of facial component, one gain insight into both the resilience and complexity of human anatomy. And this was all about the bones of skull or the skull bones. Hopefully you liked the video. If you do, don't forget to like, share, subscribe and comment. Thank you for watching. We are running out of time. Thanks.